Hi, my name is Nikki Ozier, and I will be talking about adolescent substance use treatment, and more specifically, how it differs between adults and adolescents. Why is it important to acknowledge these differences? A lot of treatment available is tailored for adults. Teens and young adults have different needs. Teens are wired to take risks and experiment, so they're more likely to use drugs. Experimentation with substance use in adolescence doesn't necessarily lead to addiction, but most people who develop an addiction later started using substances before they were 18 years old. Substance use between the ages of 10 to 24 might disrupt key periods of transition that occur. The adolescent brain is undergoing cognitive and emotional development still, and key psychosocial transitions are being made. This could look like completing education, transitioning to employment, forming sexual relationships for the first time, and then into young adulthood, transitioning to marriage and parenthood. So, adolescence, this period in itself, there's more risk of developing dependence to substances. Patterns of use. In the US, alcohol, tobacco, and marijuana are the most commonly used drugs by adolescents, typically starting with tobacco and alcohol, and then usually proceeding with illicit drugs. Adolescence is the peak period which substance use first occurs. Levels and frequency of use begin to increase in mid-adolescence and then peak in adulthood. Young adults use substances at higher rates than any other age ranges. So it's important to understand that progression, as young adulthood seems to be the period where those substances are being used the most. A small number of young people progress to regular use, and then a smaller set of young people progress to dependent use in young adulthood. There's limited studies on the differences between the treatment of young adults and older adults. Opioid deaths are lower in young adults than older adults. So this is why interviewing is early, and it's really important to prevent that. With adolescents, use is typically sporadic, opportunistic, and often experimental. Single drug experimentation is much rarer than the use of multiple substances. So adolescents aren't just trying one drug and experimenting with that, they're often trying multiple substances. Studies show that adolescents who begin the use of alcohol at ages 11 to 14 have a significantly higher risk for alcohol use disorder later in life. Early adolescent starting of smoking cigarettes also increases the future nicotine dependence substantially. And then similarly, early marijuana use increases risk for cannabis use disorder. Problematic alcohol use is associated with early use and negatively associated with cigarette smoking. So how does treatment differ with adolescents as compared to adults? The involvement of family is critical to success with adolescents. Treatment should address both the teen and the family. I think oftentimes when families bring a teen in for treatment, they think the teen's the problem. They're the ones using the substances and they want to help fix the teen. When really, treatment should look at the family system as a whole and should involve the family as well. And just kind of looking at the whole family system instead of just the teen being the issue. Teen and young adults have a lot of ambivalence and they may not be as willing to come into services. So we may have to go out into the community and find them where they are. Teen and young adults are characterized by ambivalence. It's a time where you're really not sure about your identity and you're still exploring a lot. Peers play a major role in teens and young adults. They might rely on their peers more than they rely on their family members. They may have dropped out of school or have trouble finishing school, which will be a lot different than working with adults. While adults may go back to school, adolescents still have that obligation to be in school. So that might be something you're helping them navigate as well. Services should address getting them back into school and maybe finding employment. So while you might be helping adults with some of those factors, it's going to look a little bit different with adolescents. Some warning signs in teens, and these warning signs are going to look much different with adults as well. Signs might be subtle. So they may also be symptoms of a mental health disorder. So sometimes it's hard to determine if a teen is using substances since those signs can look so similar. There might be changes in behavior, grades, also changes in friends, changes in that peer group. They might be dropping out of school, losing a job, and then they might be becoming less interested in the activities that they're involved in or sports. As I talked a little bit earlier about experimentation, if they're trying these substances and they're finding they cannot stop using those substances, that's going to be a sign to look for. If they're beginning to hide those substances and hide that substance use, when asked about their use, if they're becoming defensive or denying their use, that'll be a sign. Some risk factors, novelty, the novelty of trying these substances for the first time. And then sensation seeking. They're getting a lot of these feelings from using these substances for the first time. They've never experienced that before. Oppositional behavior and conduct disorder. Those are going to be much different with adolescents because you're not going to see that working with adults. Poor school performance again, and then just low commitment to education in general. And then many of these factors can co-occur, so they could be happening at the same time. Having common mental health disorders. So young people with common mental health disorders like anxiety, depression, they have substantially higher rates of substance use and substance dependence. And then that's higher use than people who may not have those disorders. With adolescents, those common mental health disorders typically precede substance use disorders in young people, but that's not always necessarily the case either. If they do have previous mental health problems, they can worsen or trigger reoccurrence of symptoms in young people. And so if they already have these disorders, they could be exacerbating those with their substance use. Family factors are big with adolescents. So this could look like parenting styles. What does discipline look like in the household? What do the relationships between the parents and the children, the caregivers and the children, what do those relationships look like? Are there poor relationships? Are there poor interactions? Being exposed to social and family disadvantages. And that can initiate use at younger ages as well, because they're just learning how to cope with these situations that they're in with their families, coming from families with marital conflicts. And then also parental substance use will trigger a adolescent to begin using substances as well. Strongest predictors, one study I found talked about the affiliation with antisocial drug using peers. So again, that peer group is a big factor. Some susceptible youth populations, LGBTQ plus youth in these communities have higher rates of substance use and associated problems. And then youth in these populations, their substance use is associated with victimization, negative experiences of disclosure of their sexuality, and then the lack of supportive environment. If they are not feeling like they're accepted for their identity, then they may lead to substance use. Indigenous young people report high rates of use. And then youth experiencing homelessness worldwide report high use. With youth experiencing homelessness as well, homelessness might be a result of trauma, neglect, or marginalization. And then also the prevalence of substance use disorders is greatly increased in young people who have contact with the criminal justice system. So getting treatment. When substance use disorders are identified in an adolescent, the first message we want them to hear should be that a parent or caregiver will be there for them. Families often feel guilty for missing those signs, but those signs are easy to miss, and parents shouldn't feel guilty. So, part of the clinician's job in treatment might be helping the family um, recognize that it isn't their fault necessarily that their child has turned to substance use. So, that might be part of the job there. And treatment should address mental health and primary care. It should be a well rounded treatment. It's hard to work on your anxiety or depression if you're having a lot of cravings. So it's hard to cope with those symptoms while also having cravings. Medications can help adolescents stay focused on school, work, or other goals that they have. I think there's this misconception where either clients, families, or even treatment providers think that medication is a last resort. And we wouldn't wait until someone hits bottom with asthma or diabetes before starting them on treatment. So, medications might help calm their brain from some of those symptoms that they're having so they can work on their recovery. And then most importantly is if an adolescent's basic needs aren't met, it's going to be hard for them to focus on recovery. If they're worried about where their next meal is going to come from, where they're going to sleep tonight, how are they going to focus on working on mental health symptoms or focusing on working on their recovery? So engaging youth, letting them know that you will be there for them no matter what, addressing any other challenges that they may have in their life. Youth less than 18 years old, there may be plenty of other challenges that they're facing. I think a lot of times we assume they're children and they have time for treatment, but they may not. They have many things going on in their lives too, so it's important to acknowledge that. So spending a lot of time building their trust and rapport. And then also, youth might be coming from families that have issues with communication. So that might be something that you're having to navigate as well when working with youth is maybe they're used to ineffective communication styles. So kind of helping them recognize that and work on new communication styles. You might be spending time explaining, reassuring, and demonstrating. Reminder calls, helping them with transportation, snacks, or meals during a visit. This just demonstrates that their engagement is important, and we recognize that they are more than their substance use disorders and that they have those other things going on in their lives. Also, involving the family, providing referrals for peer support, meetings like Al Anon, where families can go and learn about what their child is going through and also be able to get support for them as family members with someone that is struggling with substance use disorders. So, also family therapy, maybe providing that psychoeducation piece. It might be hard for families to understand substance use disorders. So, kind of helping them see that from a different perspective as well. So, I did an interview with Bonnie Dijkstra. She is my supervisor at my graduate assistantship. We both work in alcohol and other drug services in the counseling center at Grand Valley. She has her PhD licensed psychologist and her CAADC. And some things that we talked about were that developmentally, you tend to be stuck at the age where you started using. So their needs can be very different. Bonnie said she has worked with adults in their 20s and 30s where she feels that they were stuck at adolescence because that's where they started using. She said that some adults are just older version of adolescents. Another area we talked about is how adolescents may have to return to the environments where their use of concern occurred, and dynamics within their home can be complicated. Which that's different with adults because an adult doesn't have to necessarily go home to their family. Parents that can always be an option, but it's not the same as where adolescents, they most often have to return to their parents in that environment. And so if there's already issues within that home, that can be very challenging for them. Bonnie talked about how there was lots of times she had to help youth navigate how to handle returning to a home where there was lots of substance use still occurring and how that can be a challenge. And then again, adolescence is an age where peers are important. So that was something Bonnie spoke about a lot as well, and having their peer group. And then she also said that adolescents are going to need more physical activities to help keep them out of trouble when in treatment, and how that is not always the case with adults in treatment. And another issue she brought up that would be different with working with adults is a lot of times you might have that added issue of navigating working or work issues. While adolescents can have jobs too, that's going to look very different as opposed to an adult who may be working full time and is more required to work than an adolescent who might be still living at home and just has a part time job. So that can be very different. Also, adolescents may need consent for certain things from their parents that you wouldn't necessarily have to navigate that with adults. Bonnie talked about playing games, and how that was useful when working with youth. So, depending on their interests, she would talk to them while playing basketball or playing poker or playing card games. And she talked about how the biggest thing is making it fun, but then also allowing space for silence and letting them think. She also talked about how CBT and motivational interviewing worked for both adults and adolescents, but that games were huge with adolescents. We also talked about what some adaptations to motivational interviewing might look like for youth. And she said maybe in how it's applied, and then just maybe incorporating games into that motivational interviewing technique. She also talked about, she shared an experience with me about how she worked at an adolescent treatment center with Indigenous youth. And she stated that she would talk by storytelling with them. So, also, there's those cultural considerations when working with youth that we need to take into account for as well, and how that might look differently between age categories. And then she also talked about how she's often, when working with adolescents, has to help them with identity development without substances. So while you might be still doing this with adults, that looks very different because adolescence is that time for identity development. So whereas an adult may have had an identity without substances before, and they just have to learn that again, some adolescents may not have their identity at all. So now they have to learn that and learn it without substances. So helping them navigate that would look very different than what it might look like for an adult. Some differences in treatment. Treatment modalities that Bonnie stated were not helpful were an authoritarian or punitive approach. She talked about how blaming doesn't work. And she said that oftentimes times in substance use, we feel the need that we have to punish. And she sees consequences very different than punishment. She spoke about experiences with staff members where they were old timers in recovery and they felt that they needed to be harder on youth because they had this theory that if you knock them down, you can rebuild them. And she talked about how 99% of those cases, that's not necessary. And you can rebuild in a healthier way. She said that she thinks that technique, um, people think that that technique works with youth that have maybe strong egos or attitudes. And so she says that oftentimes that behavior or attitude is just a cover up. And a smaller percentage of adolescents who actually need that approach. But she said that it's really not necessary. And these adolescents, it could be behaving that certain way for a reason. So it's more important to um, figure out what that reason is and then helping them meet that need. Another thing she talked about was how being conscious of eye contact is important, in making sure that it's equal so that it's less intimidating for adolescents. She spoke about asking open-ended questions, looking at who they respect in their life, who are their role models. So once she kind of gets a feel for that, she can ask them questions that interest them. And she said it's more common for adolescents to give close-ended answers than adults. It still kind of depends on the person, but she said that she might have to find an area of interest with an adolescent and try to find a way to engage them there to help them open up in treatment and how that might be a little bit different than working with adults. She also talked about engaging youth. It's important to not tell them what to do, but helping them explore their options, letting them have that choice, and then not judging them. She said what's different between adolescents and adults is that if an adolescent doesn't want to hear it, they're not going to hear it. So you have to work on reducing those defenses so you can hear it. Challenges she talked about, holding their attention, and then dealing with their parents. Bonnie spoke about she has a rule. She doesn't tell the parents what she's working on with the adolescent um, because then the adolescent feels like they can't talk to her. And the only exception she has of that is if they're in danger of hurting themselves or someone else, or there's a vulnerable population in danger of being abused. So she kind of talked about walking that line of being sure that the parents trust you, but then also the adolescents can trust you and open up to you. Some common reasons that adolescents might turn to substance use, again, peer social groups. So if their peers are using substances, there's a stronger pressure for them to use them as well. Parents arguing is huge. Bonnie said she didn't realize early in her career how impactful parents arguing was going to be on adolescents and in developing anxiety or depression. And then anxiety, depression, acceptance, and then stress pressures of school. Those are all very common reasons that youth might turn to substance use. There's lots of pressure in today's society to be perfect as well. So that was one thing that Bonnie talked about. And then Bonnie also said, we don't teach people how to have pain and feel it and deal with it. And I thought that was really important because I think that's so true. We often, we don't teach people how to sit in the uncomfortableness of pain and then how to cope with it properly. So that's where youth are learning how to cope as well. So, looking at the NASW Code of Ethics, two areas that stuck out to me were competence. As social workers, we need to make sure we're competent with working with the population we're serving. So, if we are using the same treatment with adolescents that we are with adults, there might be areas that we're missing. So, just understanding those differences and being competent enough to with those populations. And then also cultural competence. It's we need to make sure of those cultural considerations when working with clients and the different populations that might be more at risk for substance use, and making sure that we're making sure that we're giving them the treatment that is best tailored to them.